Finally, this is the last recording. It's only like 8 slides. This will not take long. Um, just a note with this, because I didn't touch on it in it, that with addictions, they can be placed on phenytoin, Dilantin due to withdrawal-related seizures. If you remember, I mentioned seizures quite a bit on all the withdrawal. Okay, so nicotine replacement therapy, or NRT. The smoking sensation lessened because it's physiological and psychological, so it takes care of the physiological desire, need, or addiction to the nicotine, while you're dealing with the other side effects. Side effects, note here, worse side effects with lower body weight, and caution, note, do not smoke while using NRT. Needs to be combined with behavior counseling due to addictive behavior. These products do not contain many of the toxins found in smoke. The goal is to cut down on cravings for nicotine and ease the symptoms of nicotine withdrawal. If they're using a patch, paste the patch on a different area above the waist and below the neck every day. Put the patch on a hairless spot. People who wear patches for 20 hours, 24 hours will have fewer withdrawal symptoms. Do not chew more than 20 pieces of nicotine gum per day. Insert nicotine cartridges into the inhaler and puff for about 20 minutes. Do this up to 16 times a day when they're using the cartridges. Spray should not be used for longer than 6 months. This one, so there's different types. Okay. Bupropion for smoking cessation, which is Wellbutrin. I think it's some places listed as a TCA, tricyclic, and some just call it its own class. I can't think of the word right now. Action is unclear. Proper release of dopamine. This is another drug that actually works really well for seasonal affective disorder, but in a different dosage. The bupropion for smoking cessation is a very low dose. Start 2 weeks before quitting smoking. That's important. Contraindicated in seizures, bipolar, eating disorders, and pregnancy. Varenicline, or Chantix. I have to say Chantix because I can never say that name. For smoking cessation, decreases nicotine cravings and withdrawal symptoms by stimulating nicotine receptors. Start 1 week before starting smoking. It usually comes in a starter pack, and then possibly up to 3 months where it tapers them back off. Take with food and a full glass of water. I've seen lots of success with this, but some people, the nausea and vomiting and vivid dreams is too much and they stop it. Adverse effects: psychosis, aggression, angioedema, seizure. Not common, but when it happens, it happens. Alcohol abuse and nutrition. Displaces calories from needed nutrients, interferes with body metabolism of nutrients. Here, replace your thiamine, your folic acid, vitamin A, magnesium, and zinc. These are all big, but thiamine, folic acid, magnesium, what I've seen the most. Ethanol inhibits the absorption of your folate, leading to a megablastic, large cell pale anemia. Thiamine leads to encephalopathy, that's inflammation in your brain, or later something called Korsakoff's psychosis, and they tend to be underweight with a BMI less than 18.5. Disulfiram, I think I mentioned that word when we talked about, not sure if we've covered anti-infectives. If I did, a metronidazole or antifungals can also have this disulfiram effect, or antabuse, blocks metabolism of alcohol in the body. Alcohol deterrent, prevent relapse. It's an alcohol antagonist, only administer a minimum of 12 hours following minimum. Because that alcohol, if you drink alcohol when you're on it, if you drink it, take this too close to it, if ingest alcohol, intense. I mean, it is intense, where they land in the ER calling 911. Significant severe nausea, vomiting, respiratory difficulty, hypertension, possible cardiovascular collapse, and shock. It is extreme. Drug interaction, note here, may lead to phenytoin toxicity. So they may be on phenytoin because of the seizures with alcohol withdrawal. So note that. Okay. Naltrexone or Vivitrol prevent alcohol or opiate use relapse. I have seen this work wonders doing the IM once a month. It's a daily tablet or IM injection once a month. Caution, they must abstain from, sorry about typo, opiates or alcohol 7 to 10 days before dosing. Can be indefinite. It is non-addictive. It's not used much. I wish it was. It reduces your cravings. It blocks the euphoric effects of opioids and alcohol. Side effects: GI upset, diarrhea, headache, joint, muscle aches, fatigue, sleep problems. I saw some GI upset. I've only had a few patients that were willing to try it. The problem is the cost in getting it covered. For some reason, they want to cover things that are like substitute addictions, but adverse effects: liver damage, localized skin reaction. The localized skin reactions with the injection. If used opioid or alcohol while taking, it can lead to sensitivity and an overdose. Methadone. I didn't realize I don't have a slide on Suboxone. That's the newer one that's out there. But methadone prevent opiate relapse, used in detox and maintenance. So is Suboxone. Opioid agonist blocks opioid receptors in central nervous system only to prevent uric effects while providing pain relief. That's where it's really effective for that chronic pain person. So they will still have pain relief, but they're not getting the high. Caution, caution, caution. Wean off to prevent withdrawal. It is addictive. It does cross the placenta, enters breast milk. Adverse effect: respiratory depression. That's why it's done in even outpatient, but it's done in a specific setting with specific licensure and training. It still is a narcotic. They just don't get the euphoric effects. Drug interaction with other central nervous depressants because it is a narcotic. And herbs such as St. John's wort and valerian root. And I told you this was a short recording, and that is the end.